The next issue is celiac disease, gluten sensitivities, and other food allergies. Celiac disease. All right, so celiac disease is an autoimmune disease. Celiac disease is a very, very serious disease. It is, as a 15% of the time, it will precede or be associated with diabetes type 1. It'll also, 5% of the time, be associated with hypothyroidism. All of the time, it creates a whole series of symptoms that we're going to talk about. It is an autoimmune disease as a consequence of genetically susceptible individuals triggered by gluten and related proteins in wheat, barley, and rye. Now, there's a trick here. 35% of the population has the genetic susceptibility to developing celiac disease. Only 3% of the population will ever develop celiac disease. So the issue is genetic susceptibility plus gluten plus something else that trips you off into developing celiac disease. One of the things that shows up repeatedly that precedes the development of celiac disease is leaky gut, a bacterial infection that somebody had, high stress period where they were having problems with gastrointestinal symptoms that preceded the diagnosis of celiac disease. The average time to diagnose celiac disease in an individual is 11 years. These problems go along a long time. Now, the other kicker is the average age of diagnosis now of celiac disease, all right, a genetic disease which we thought was predominantly happening in kids, is between the ages of 40 to 60. So if you have the genetic susceptibility and you don't have celiac disease now, it doesn't mean that you won't have it later. So if I end up testing somebody, and we can do genetic testing for celiac disease, and there's a very high risk of you having celiac disease genetically, but you don't have it, we take you off gluten. We want to see if that will actually prevent you from ever tripping over and developing celiac disease. We'll just get ahead of it. So you can think of this from a preventive standpoint also in looking at the genetic analysis. This goes back over the prevalence in the entire population. It's 1%. We don't diagnose it enough. Look at the number of people we're missing because we don't think about it enough. Typical age of diagnosis we talked about and the delayed diagnosis. And this is the other thing that becomes tricky in celiac disease. So the typical symptoms of celiac disease are intestinal, obviously, but there's lots of atypical symptoms that we don't think about, the end result of which is the typical celiac presentation is actually a very small number of the total number of people who have atypical presentation of celiac or individuals, either genetically susceptible people, who haven't yet developed celiac disease. So most of celiac disease isn't presenting with the typical signs. And the typical signs are diarrhea, weight loss, fat in the stool. That should never, ever, ever, ever be in the stool. If fat's in the stool, it's a serious problem and has to be worked up. Bloating, lactose intolerance. Lactose intolerance. Anybody got lactose intolerance? So these are the common symptoms that you see with people complaining of who actually end up having celiac disease. Obviously, most of the people with these symptoms will not have celiac disease, but these tend to be fairly dramatic in people who have celiac disease, more so than people who have what we call irritable bowel syndrome. But the other symptoms of celiac disease are where everybody trips up. So iron deficiency anemia, chronic iron deficiency anemia, low-grade anemia that people call chronic disease. Yeah, it's chronic disease. If you didn't go look for celiac disease, you may have missed it. All right? There's skin rashes that are particularly unique to celiac disease, chronic fatigue, ADD, ADHD, early osteoporosis. If you're in your 40s or your 50s as a woman, or a man for that matter, and you start developing osteoporosis, the next question that has to be asked is, do you have celiac disease? Joint pain, autoimmune diseases that we already talked about, infertility. Infertility, women who are having trouble getting pregnant need to be checked for celiac disease. It is one of the presentations of celiac. Migraines. All right, I have a patient in my practice. Her presentation for glucose intolerance for celiac disease was migraines and panic disorders. She was seeing a psychiatrist and a neurologist. All right, so the neurologist is treating her migraines for her migraine problem. The A psychiatrist is going on and on about how come you have, what trips off these panic disorders, what was your childhood like? Her childhood was pretty damn idyllic. She had a great life. She was extremely competent and successful in her career. What he should have been asking is, what are you eating before you have your panic disorders? Because that sandwich you had for lunch is probably what's tripping it off. But we think of psychiatric diseases as psychiatric diseases, and we think of pain or migraine as pain diseases. They are neuroinflammatory diseases. And we have to go look for the cause of the neuroinflammation. Vitamin deficiency, vitamin D, people who have a devil of a time keeping their vitamin D levels up, in particular, the fat-soluble vitamins A, D, K, are the ones that you've got to be paying attention to. All right, now this is a controversy that we get into. This is the type of testing that can be done for this, and I just gave this lecture at a medical conference over the weekend, which is why this slide's in here. But what you need to look at is sensitivity and specificity, okay? Sensitivity is of everybody who has the disease and everybody who might have the disease, how many do we pick up? And the answer is these tests, especially down in this region, are pretty sensitive. So they don't miss a lot of people who have the disease, but they're going to pick up some people who don't have the disease. On the other hand, when you go to the specificity column, it's how many people are going to have this test positive that actually have the disease. That is, we won't get false positives. So as you look at these numbers, if you get a couple of these tests that are positive, you can make a diagnosis of celiac disease based on the blood work. Now, so there's a 4 out of 5 rule that's promulgated by the Europeans and is ignored by the Americans. So the rules are, if you have signs and symptoms of celiac disease, and as you've seen, the signs and symptoms are quite extensive. If you have positive serum celiac disease autoantibodies, those are the ones I just showed you. We're going to skip over this. If you have a response to a gluten-free diet, and if you have the genetic risk. Small intestine biopsy is virtually 100%. And that's what we insist on in the States. Okay? So I just ran into a situation where I had diagnosed a woman, an adolescent, who has celiac disease. All right? She's been worked up in a multitude of centers for chronic pain problems. I think of it as a neuroinflammatory disease, so I say, okay, what causes neuroinflammation? I start down my checklist. We look at celiac disease, and sure enough, she lights up straight across the board with all of the markers. Not one, not two, but virtually all of them. Okay? So I said, you have celiac disease. She went to the celiac specialist at a local hospital who said, nonsense, you can't make the diagnosis based on that. I don't believe you have celiac disease. So he sent her for a biopsy. The biopsy shows she had celiac disease. You can make the diagnosis on the basis of the lab work and with a proper history and physical. So not everybody needs to go to endoscopy in order to prove that you have celiac disease. Our blood tests are adequate along with the rest of the history. Neurologic symptoms that we see in celiac disease, and again, look at the list, okay? Psychiatric disorders, depression, ADD, ADHD, anxiety disorders, migraines, carpal tunnel. All right, and it's not a small percentage. Even seizures can present as celiac disease. We have to be thinking about these things. If we recategorize these diseases as neuroinflammatory diseases, this becomes one of the questions we ask. All right, gluten sensitivity is a different thing than celiac disease. So gluten sensitivity has a lot of the same symptoms that celiac disease has, but it's not an autoimmune disease. Okay? So it looks like, so people who have celiac disease can't have gluten, period. Ever, never, done. No gluten. It's going to immediately incite an inflammatory response in your body. You're going to be sick as a dog. And certainly my celiac patients who we've gotten off gluten completely know when they have been glutened. They get sick. So gluten sensitivity, on the other hand, in about 6% of the population. So where we had 1% of the population have celiac disease, 6% of the population we know is gluten sensitive. And we're not sure what it is exactly with the immunology of disease is, but we know it exists, and we've had it well documented. So the symptoms: headache, brain fog, depression, numbness in the extremities. But you go back in terms of gluten sensitivity, and the way you make that diagnosis is you take people off gluten for 6 weeks. All right? And the way I make that diagnosis is I give them a very specific diet: rice, fish, chicken, fresh fruits, and vegetables. If it ain't on that list, it ain't on your diet. Nobody likes me when I put them on that diet. There's 2 weeks where you go through a really difficult period because you may actually have withdrawal from being off some of these foods, and you have cravings for them, and you don't feel as well, and then your brain starts to wake up. And you suddenly realize you've been dragging, and your energy hasn't been what it should be. And as your brain starts to wake up, you start to feel better. The problem comes in at 6 weeks now. At 6 weeks, you feel better. You've got more energy. You've got less aches and pains. You're sleeping better. You're feeling refreshed when you get up. And then somebody comes to me and says, okay, now what do I do? Well, now you have a choice. You know what the food does to you. If you eat it on a regular basis, you go back into the fog. If you take it out of your diet, you're out of the fog. We have to get you out of the fog first so that you know you're in it. Then you can be a little clear-headed about thinking about what it is might also be coming to play here. The other thing that looking at, look at these numbers in terms of vitamin deficiencies by the average American, okay? These numbers date back to 2011, but 34%, 25% on vitamin C, 70% on vitamin D, and D is essential for functioning of the innate immune system, okay? And we're particularly harping on the innate immune system because the inflammatory mediators in the central nervous system, those things that are causing all of these symptoms of headaches, chronic pain, depression, anxiety disorders, are the innate immune system in the central nervous system. They need vitamin D to function normally. So getting vitamin D levels up and normal is crucial. Vitamin E, calcium, magnesium. Magnesium is particularly crucial also because, this gets a little technical, but basically there are receptors. The highest percentage of neurotransmitter in the central nervous system is glutamine. It is an excitatory neurotransmitter, and it needs to move through a receptor called an NMDA receptor in order to enter the cell. Magnesium molecules sit on top of this receptor, blocking it, so the neurotransmitter can't enter. When you have a deficiency of magnesium, glutamate moves into the cell rapidly and readily and keeps them in a hyperexcited state. That hyperexcited state results in sleeplessness, pain, and so agitation. So checking how much magnesium is in your system and making sure that you're getting adequate magnesium and knowing that 35% of the American population is deficient in magnesium is a rather important thing. More than a couple of years ago, but when we first started working with magnesium, we had a couple of women who had been through fairly extensive workups trying to get pregnant, infertility problems. And they had failed a couple of in vitro processes. And we checked them for magnesium, not because we were thinking about anything about fertility, but because we were treating pain problems with them. And we found they were significantly low in magnesium, and we gave them magnesium, and it was successful in terms of helping with their pain. But they then came back several months later and announced that they were pregnant. And then we looked in the animal literature and found that magnesium deficiency is associated with infertility. And we passed that information on to a couple of our colleagues who were in the infertility field, but nobody seemed to be interested. So, it's not where we do our research, but it's something easy to think about. The catch and the problem with magnesium is that 60% of magnesium is in the bone, 38% of the magnesium is in the tissue, and only 2% of magnesium sits floating around in the blood. When we measure the blood levels, the only thing we can find is end-stage disease if it's there. We don't find earlier signs of the disease because that blood level is preserved at the cost of the intracellular levels. So you will have no magnesium left in your body at the point that the blood levels say you're low. So measuring blood levels is a waste of time. So you have to figure out a way to measure intracellular magnesium. There's a couple of ways to do it. We use a test called intracellular diagnostics, and it's proven to be a pretty stable test, meaning that it's reproducible. We can send out multiple samples from one individual and get the same result back. So you can do that with RBC, red blood cell magnesium levels also is another way to look at it. We've used that test. We have not found that test to be as reliable and as stable, so this is why we go back to this test. In this particular case, you see a magnesium level of 31.5. This was a 24-year-old woman who had generalized pain, fibromyalgia, and sleep disturbances. Her levels, when you start getting down to 30 on a magnesium, you're at risk of sudden death from heart attack, from cardiac arrhythmias. So this is a very serious low level of magnesium. Women in particular are susceptible to magnesium deficiencies because of blood loss from the menstrual periods. So magnesium deficiency, and this is why we get back to my recommendation that we saw earlier of taking upwards of 360 milligrams of magnesium a day. I told you somewhat about this case, and these are the results of her antibody testing. There's nothing subtle here, right? And I got another doc who's supposedly a celiac expert arguing with me. Her risk, interestingly enough, was only 2 times greater than the general population. This is a genetic test that we do. It's called Prometheus testing that we run on them. But nevertheless, it puts her at an increased risk. It doesn't seem to matter whether or not you're at increased risk. It only matters what level increased risk, rather, that you're at. It only matters that you're at increased risk. So the genes are there that can be triggered. This was another case that we're treating. This kid, very severe depressive disorder. And again, he's being treated for a depressive disorder. And suicidally depressed. And we found again, because we think these are neuroinflammatory diseases, and looking on him, he's got celiac disease. We take him off gluten and his brain starts to wake up. Now, it's more complicated than that. Gluten isn't always just the answer, because he's got a leaky gut, and we've got to address that as well. We also have to take a look and see whether or not there's an overgrowth of the C. diff species I had talked to you about earlier. So, again, in him, there's no subtlety here, and there's lots of internal consistency. And there's an explanation for why this IgG would be off, but you don't need to be concerned about that. But all the IgAs are positive, all of them. And again, not subtly so. We don't make a diagnosis of celiac disease lightly, but when it's there, it's there. His risk factor genetically is 10 times. Now, we did a bunch of food sensitivities on him, and we find this is what we see in a leaky gut situation. Look at all the sensitivities that he's got to other things. Sesame seeds, coffee, various types of components of milk. Some of the grains that are typically used to substitute for gluten. So you've got to be very careful, and it's not unusual to see a lot of this crossover in people. So until we get the gut sealed, we're not going to be done with this kid. We got a lot of work to do with it. So central sensitization syndrome is a neuroinflammatory diseases. Chronic pain, depression, anxiety, post-traumatic stress syndrome are symptoms of a neuroinflammatory disease process. You treat the cause, not the effect. Cause is neuroinflammation. In this particular case, we want to look at metabolic syndrome. We want to look at obesity. We want to look at leaky gut. We want to look for celiac and gluten intolerance. We want to look at vitamin and mineral deficiencies, all coming into play, potentially contributing to or potentially being directly causative of the disease. We also look at neuroinflammation as a process. So in medicine, we tend to look at life as an event. This happened and then I got sick. When in reality, a lot of things have happened that have led up to the tipping point that brings you into the office. And if all we're focused on is the tipping point, and we miss all this stuff beforehand, we miss the diagnosis, and we miss the opportunity to actually get you cured. We can treat symptoms galore, but we can't cure you. So hypoallergenic diet, rice, fish, chicken, fresh fruits and vegetables. We let people have olives and olive oil and a little bit of red wine, but nothing packaged, nothing processed. in any way, shape, or form. A patient of mine just sent me a video of somebody who had gone into a McDonald's and bought a chicken McNugget and then proceeded to stick it under a microscope and look what was there. All right, they found inorganic fibers as part of the chicken McNugget. That's not food. It's not even a food substitute. So, you know, we need to pay attention to what we're eating. We need to be thoughtful about what we're eating. And when we put people on this diet, it does not eliminate everything that you may be potentially allergic to. But what it does is it gets rid of all the big things. And so that fog starts to lift. And then to be effective on this, the next thing you need to do is to keep a bit of a log. You need to become mindful about what it is you're putting in your mouth. You need to pay attention to how you feel after you eat things. And it's particularly helpful if you're writing down periodically, and we'll have people just keep a list, what's your energy level, 0 to 10, 10 being best. What's your pain level, 0 to 10, 10 being worst. Okay? Any issues with brain fog, any issues with irritability, your mood, rate it again on a 10 scale. That's it. And do that log periodically throughout the 6-week period that you're on the diet. And then start seeing how you feel when you eat various foods. If you eat something and you find that you get nasal congestion, you shouldn't eat it. Your body's telling you you're allergic to it. If you eat something and find you wake up the next day and you're really stiff and you're really sore, don't eat it. So this is the beginning of the discovery process of what it is you can and should not be eating. So we went through a lot of material. We covered a very broad spectrum. This is not about eat this and you're all better. Okay? This is about taking care of ourselves in a total manner in which we're paying attention to all the foods we're putting in, we're paying attention to all the symptoms we're having, and we're doing what we need to do to change our lifestyle and our eating habits in such a way that we can remain healthy and reduce the inflammation in our body. That'll start reducing the pain, that'll start reducing depression, anxiety disorders, and allow us to return to complete and total health.